SISKI is a System Improvement Through Service Collaborative initiative. It's a project sponsored by CAMH, Center for Addiction and Mental Health.
The service collaboratives have been a really wonderful opportunity to bring groups of people together who don't normally work together on problems in the community.
They're all locally owned, meaning that the local community partners work together and determine the agenda and identify the system gap and pursue the solutions that they determine are most appropriate for their community.
It's meant an opportunity to develop some new relationships with agencies that are funded, by different ministries and who might share populations, but we've not traditionally, as odd as that sounds, we've not traditionally done much work together.
Service collaboratives are an opportunity for the Toronto Police Service to meet with different stakeholders within the community when it comes to dealing with people with mental health issues or people in crisis.
Donc le projet axé sur la collaboration nous a permis comme communauté entière de se retrouver pour parler de qu'est-ce qu'on pourrait faire comme communauté afin de subvenir à leurs besoins.
So that we can look for gaps within the system and find ways to eliminate or reduce those gaps.
I didn't know what the services were. I didn't know how to get them, and I didn't know where to go.
Les élèves ont de la difficulté à naviguer ces services. Les familles également.
They may need, different services from different places. So if they don't understand or they don't know where these places are or what they provide, they're going to be missing out.
53% des répondants francophones disent pas avoir accès à des services de santé mentale en français.
Because our students are First Nations and they come from very remote areas to a place like Thunder Bay, which is considered quite an urban center, where they're dealing with street lights and buses, and they're away from home, living in strangers' homes, so transition piece was huge.
He wasn't old enough to utilize adult services, but he was getting too old in the sense that his behavior was more than they could manage in the youth sector, and they felt that because he was going to be turning 18 shortly, that we should start to be planning in the adult sector.
With the service collaboratives, I think there's the resources that CAMH has with the teams that will be able to make the process really, a scientific process, be able to look very closely at sort of what are the key issues, how best to address those issues, and then implement them and then evaluate them.
Well, implementation science really supports a staged approach to implementation, where you really spend some time at the forefront making decisions around what would be the best intervention for this community. Is it evidence informed?
La lentille francophone, ça veut dire que dès lors qu'un projet est réfléchi, on pense, mais c'est quoi les besoins des francophones? Sont-ils différents des besoins de la majorité?
Trying to use the best evidence as possible. Evidence being from the research, from literature, but also from clients and families with lived experience and clinical and professional expertise.
I got involved in November 2012. I was able to share my story and let parents know what was going on, as well as different professionals in the community.
What are some of the issues? What is affecting youth now? It changes from, year to year, from decade to decade.
I am now the Center for Addiction and Mental Health, Emergency Department in Mental Health Crises, project lead. We
really need to have youth who are, a voice and can speak out and say what their experiences are now and the troubles that they face.
It's really nice now that my story's out there, just to kind of keep going and be who I am.
The roots of the Service Collaborative Initiative go back to Open Minds, Healthy Minds, which is Ontario's comprehensive mental health strategy.
Obviously, the 10-year strategy is very important to all of us because the government has made a strong commitment to helping communities change.
To bring people together to talk about community solutions.
The initiative is important so that youth can get the proper care that they need, in hopefully a timely fashion.
We want to ensure that whatever intervention is chosen by the community is one that can be sustained in the long term.
So I hope that what's achieved from the process is some really good practices, some good implementation tools that can be implemented and used across the province.
Pour nous, comme conseil scolaire avec un mandat d'éducation, il s'agit plus que de garantir leur réussite, mais de garantir leur bien-être.
So the system's better for children, youth, and adults who intersect with the justice system.
When we have happier people within the community, we have safer communities and healthier communities.